Good morning and welcome back to Open Med School. Last time we have discussed about the production of thyroid hormone. Today I will be discussing about hypothyroidism. What is hypothyroidism? Hypothyroidism is a condition characterized by underactive thyroid gland leading to inadequate production of thyroid hormones, primarily thyroxine and triiodothyronine, that is T4 and T3. So hypothyroidism, what is hypothyroidism? Basically, there is decrease in the amount of the thyroid hormones, that is T4 and T3. Let us look into the etiology. Hypothyroidism can be divided basically into primary hypothyroidism and secondary hypothyroidism. What do you mean by primary hypothyroidism? Primary means the thyroid gland per se is defective. Secondary means thyroid gland is normal but it is not acting because the thyroid stimulating hormone is not adequately produced. So what are the causes of primary hypothyroidism? One, autoimmune thyroiditis. Antibodies are produced against the thyroid gland. So example, Hashimoto's thyroiditis. That is the most common. Second is iatrogenic. This can occur from thyroidectomy or giving radioactive iodine therapy. Then there are congenital hypothyroidism, which is present from birth due to thyroid dysgenesis. And drug-induced. Many drugs like lithium, amiodarone, interferon-alpha can produce. So these are the primary hypothyroidism. Secondary hypothyroidism is due to defect in the pituitary hypothalamic dysfunction. And this leads to inadequate stimulation of thyroid gland. For example, a patient has got a pituitary tumor that has produced damage to the pituitary, and so there is not sufficient production of the TSH. Another example is viper bite. Following viper bite, there can be dysfunction of the pituitary gland. Very important condition is the Sheehan syndrome, postpartum pituitary necrosis. So there are so many other causes of pituitary dysfunction that can lead on to thyroid dysfunction. As we know that the TSH is the hormone that stimulates the thyroid gland, disorder of the pituitary can lead on to hypothyroidism. Now, how will you differentiate these? That we will discuss during the thyroid function test. Now we look into what are the clinical features. The more any system can be affected. Patient can come with a neurological dysfunction, gastrointestinal problem, GIT problem, because every cell requires thyroid hormones. Some of the common clinical symptoms are fatigue and weakness. This is very common. So it may be confused as depression. Weight gain. Despite reduced caloric intake, patient gains weight. Cold intolerance, because heat production, the sodium potassium pump is for the thermogenesis, and this is because of the dysfunction. The patient cannot generate heat. Constipation due to reduced gastrointestinal is a very common symptom. But again, remember, constipation can be due to various causes. Dry skin and hair, decreased sweat production and oil production in the skin. Bradycardia. So menstrual irregularity, especially menorrhagia, and already mentioned about depression. And there some neurological symptoms can vary from subtle to major. For example, patient may come even with coma, that is, patient may come with altered mental status, depression, dementia. So many, and another very common symptom is carpal tunnel syndrome, paresthesia affecting hands. Now going to the physical examination, the patient may present with the goiter, that is, swelling can be present. Pulse rate, say, because the sympathetic activity is decreased. The thyroid hormone enhances or facilitates the action of the sympathetic nervous system. The coarse hair, dry skin, and periorbital edema can be, and the lateral one-third of the eyebrows can be decreased. And one important clinical examination finding is a delayed relaxation of deep tendon reflexes, especially the acupuncture. Now going to the thyroid function test, the most important test is the TSH. TSH is elevated. What is the reason? The reason is because the T3 and T4 inhibits the production of the TSH. That's a negative feedback is there. So once the negative feedback is there, is removed, so what happens? The body will try to produce more of TSH and decrease in the amount of the T3 and T4. And as we have mentioned, some of the hypothyroidism can be due to autoimmune problems. So you can look for the thyroid peroxidase antibodies, anti-TPO antibodies. This suggests autoimmune thyroiditis. Then remember the secondary hypothyroidism, what is happening? The TSH will be low, T3 and T4 will be low. So usually we expect a when thyroid is failing, you expect that the TSH is elevated. If the TSH is low or inappropriate for the level of T3 and T4. So then what do you mean by inappropriate? For example, somebody has got a significant symptoms, hypothyroidism, you expect a TSH of 50 or 100, but it may be only 6 or 7 with the T3 and T4 low. You should always suspect secondary, that is pituitary dysfunction. Then goes to the imaging. You can go for the thyroid ultrasound. This will go for the structural abnormalities, then radionuclide scans. Get to identify the functions. What's the treatment? Hypothyroidism is eminently treatable. The T4 replacement therapy, standard treatment is to normalize the thyroid hormones by replacing the T4, the thyroxine. Start with the low dose and you titrate based on the TSH levels. Again, remember 4 to 6 weeks are required for the stabilization, and once you start on treatment, wait for the 4 weeks for checking the TSH result or TSH function, TSH amount values. Regular thyroid function should be tested to see that the patient is taking adequate medication, and usually the T4 is given or thyroxine is given in the early morning on empty stomach. And try to maintain the TSH within the normal range. Patient should be educated because the medication is required lifelong. Regular follow-up with the patient is required, and be aware of the symptoms of over treatment and under treatment. What are the complications of hypothyroidism? The complications can be the patient may come with mixed hemochromatics, but it's rare, it's a life-threatening. Cardiovascular complications, risk of atherosclerosis, and heart disease is increased. Adverse effects on the fetal development. So it is mandatory before become pregnant, you should check the thyroid function. Hope this is useful to you. Thank you.